Hello everybody, my name is Quinn,
My name is Pedro.
and today we'll be talking about cochlear implants. We'll be going over why this implant was created, the healthcare professionals at play in the pre, intra, and post-operative care, medical terminology used throughout this procedure, and the steps of the procedure itself.
A cochlear implant is a medically inserted device designed to restore hearing by sending electrical signals directly to the cochlea. The word cochlear comes from the Latin and Greek roots. The word root cochleo refers to the cochlea, a spiraling shaped part of the inner ear responsible for hearing. The suffix ar simply means pertaining to, so cochlear literally means pertaining to the cochlea. Now, the term implant refers to any device that is medically inserted into the body to replace or support a biological structure. Together, the phrase cochlea implant describes a device that is implanted to help individuals with severe hearing loss to hear again by directly stimulating the auditory nerve through the cochlea. It's a powerful example of how medicine and technology come together to save and change lives. These devices can be pretty pricey, costing between $50,000 and $100,000. That includes the device, surgery, rehab, and hospital fees. The good news is most private insurances, Medicare, and Medicaid help cover these costs. In fact, Medicaid usually covers about 80% of these costs. Now, are people happy with their implants? According to the study of York University, definite yes. 72% of users said they were very satisfied. 24% were satisfied, and only 4% weren't happy with the results. And for those wondering if it really helps, 82% of adults with hearing loss who got the implants showed major improvement in understanding speech by at least 15%. So overall, while it's a big investment, they do really make a big difference in people's lives.
Now we will go over some healthcare providers and why certain people might require this medical intervention. First, otolaryngologists are ear, nose, and throat doctors that can diagnose if someone's hearing loss would make them a candidate for a cochlear implant. They are also the surgeon who will be performing this procedure alongside a team of nurses, surgical technologists, and an anesthesiologist. Audiologists are healthcare professionals that can also help diagnose if someone might need a cochlear implant. Following the procedure, a patient will often visit an audiologist several times to calibrate their cochlear implant to their specific needs and preferences. Anesthesiologists are doctors that administer anesthesia, which is a medical treatment that puts a patient into a state of controlled unconsciousness. This is done as a form of pain management for the patients as they are essentially sleeping throughout the whole procedure. This also creates an easier environment for the surgeon since a patient that's unconscious won't be moving as much during critical steps of the surgery. Speech pathologists are healthcare professionals that treat communication and speech disorders. For cochlear implants, these professionals are most often needed for child patients to help them better interpret sound created by their cochlear implant and help make sure they're reaching their language learning milestones. Now on to the types of patients that are candidates for cochlear implants. Cochlear implants were created to help people with hearing loss that can't be improved with hearing aids. These implants only work if a patient has a healthy cochlea and auditory nerve, since these are the two organs the implant stimulates to generate sound. People with auditory nerve damage from an accident or structural abnormalities like cochlear dysplasia may not be candidates to receive this device. Children born deaf or with severe hearing loss are recommended to get a cochlear implant prior to the age of 3 to ensure the language and sound processing areas of the brain develop properly. Next, we'll be going over the preoperative, intraoperative, and postoperative care that someone will receive during the journey of receiving a cochlear implant. A potential CI user will first meet with their healthcare team. After going over all of their medical history and experience with hearing loss, several tests are performed. One of these tests is an audiogram, which is a hearing test that determines what specific frequencies a person can hear and the volume required for these frequencies to be detected. It is important to note that this test will be done both with and without a hearing aid to see if a less invasive solution can solve the problem. Next, radiologic imaging is done. This is most often an MRI or a CAT scan, and is done to examine the anatomy of the inner ear to determine if any structural abnormalities would affect surgical outcomes. I mentioned 2 of these in the previous slide with cochlear dysplasia or hearing nerve damage. These scans will also be examined the day of the surgery to aid the surgeon in planning out the surgery. If it is determined that the patient is a worthy candidate, their team will go over the risks, benefits, and recovery following the surgery to help them make an educated decision on whether or not they want to move forward with the procedure. If they do, then a date of the procedure is scheduled. Next, we'll be going over the intraoperative care of the procedure itself. I got this information from a journal written by Dr. Cliff Magarian, who is the medical director of adult and pediatric cochlear implants at Cleveland University Hospitals. On this slide, I summarize this journal into what I think are the most significant steps of the procedure. In step 1, the patient is put under general anesthesia and placed into a supine position with her head rotated 180 degrees from the surgeon. An incision is made post-auricularly, meaning behind the ear, to gain access to the mastoid bone. A mastoidectomy will be performed with a cutting burr to provide access to the inner ear. Step 4 is to perform a posterior tympanotomy, which in lay terms is a small incision of the tissue directly behind the eardrum. This incision will allow the small electrode from the implant to run directly to the round window membrane. This membrane is the flexible tissue that separates the middle ear from the cochlea. Step 5, removing back to the mastoidectomy site and drilling a bone well, which will later fit the internal receiver flush with the rest of the skull. Next, a cochleostomy is performed by creating a small opening in the cochlea that is created at the same diameter of the implant's electrode. Next, the internal receiver is placed into the bone well that was created and sutured into position. Nearby fascia is grafted and placed over the receiver, which will heal and secure it in place even more. Step 8, the electrode is run from the internal receiver through the tympanotomy site and into the open created by the cochleostomy. The surgeon pushes the electrode into the spiraling structure of the cochlea and stop when they feel the electrode reach the end of the cochlea. The final step is to test the electrodes to make sure they weren't severed during surgery. The skin flap is sutured back down and the site is covered with a sterile dressing. During my research on Dr. Magarian's surgery, I was amazed by how complex the anatomy of the ear is and how most of the surgery is done in a space that only spans a couple of inches. I also think it's cool that the surgery has an otomy, ectomy, and ostomy during it, and gives a great practical example on each one's specific purpose. After the surgery, the patient will follow the instructions given to them on how to properly care for their wound site to reduce risk for infection. They will return to their audiologist when the wound is fully healed, typically in 3 to 6 weeks, and this is when they also receive the external component for the implant for the very first time. After an initial calibration of the device, the patient will likely need several follow-up appointments as they adapt to their device more and figure out how to use it. Lastly, auditory therapy may be needed especially for young children or adults that have had severe hearing loss for an extended period of time. So I wanted to give an example of a short conversation one might say to someone unfamiliar with medical terminology who is considering getting a cochlear implant. If hearing aids aren't helping you understand the people around you, consider asking your doctor about a cochlear implant. It is done by making an incision behind the ear, removing a small amount of bone where the implant is set. A small wire runs from the implant to the part of the ear that has been inactive due to hearing loss and stimulate it directly, bypassing the damaged part of the ear. This is a short procedure taking only 1 to 3 hours, and the recovery is between 3 to 6 weeks. When fully recovered, you'll meet with healthcare professionals who will program your implant and help you maximize the benefits of having this device. To better understand the anatomy at play during this procedure, here's a YouTube video made by Ohio State University Wexner Medical Center.
The cochlear implant surgery is performed under general anesthesia, which takes about 1 to 2 hours. The surgeon will shave minimally behind the ear so that the incision is free from hair. The internal processor is placed into a soft tissue pocket or a small depression in the bone. The surgeon drills away some bone in order to reach the cochlea. The electrode array is then inserted into the cochlea in a slow and controlled fashion. Once the components are secured into place, the incision is closed with absorbable sutures, so nothing needs to be removed in clinic. Typically, some sticky medical-grade tape is placed along the incision to help the healing. This will fall off on its own. Lastly, a plastic cup dressing will be placed on top of the ear. This can be removed the next day. You will be going home the same day. Patients can spend an hour or two in the recovery unit. It is normal for them to feel nauseated and drowsy when they immediately wake up. The anesthesia team can give both anti-nausea and anti-pain medication while they're in the recovery unit. The patient will also receive a pneumococcal vaccine in the recovery unit before they go home.
The following case study is fictional and made for educational purposes. This case study follows Jordan Miller, a 47-year-old male with progressing hearing loss due to otosclerosis affecting the cochlea, complicated by tinnitus, laryngitis, and balance issues from the vestibular nerve involvement, leading to his evaluation for a cochlear implant. The following are from the case studies, and these are the medical term translations for the following.
And to end our presentation, here's a critical thinking question. How would it be determined if someone is a candidate for a cochlear implant from the perspective of both a patient considering getting one and a healthcare provider who specializes in this procedure?